everybody. This is Greg Stock, CEO of Thibodaux Regional Health System. And again, we have with us Dr. Bryce Casteigne. He's a young neurologist, fellowship trained in strokes. And today we want to talk a little bit about strokes. So we can start with basic questions like, what is a stroke?
Sure. So there's two subtypes of stroke. When you think about what a stroke is, there's what we call an ischemic stroke, which is a blocked blood vessel leading to tissue damage from that blocked blood vessel. Your brain needs oxygen and nutrients to survive. When you block the blood flow, you take permanent damage. There's also the bleeding type of stroke, what we call a hemorrhagic stroke. By and large, the majority of strokes are ischemic. I'd say 85-ish% of strokes are ischemic, so the blocked blood vessel type. And some of the risk factors that can cause these ischemic strokes and hemorrhagic strokes are some of the risk factors that we all deal with. Things like high blood pressure, high cholesterol, diabetes, smoking, and the one none of us can do anything about is age. You know, normal wear and tear on the vessels over time.
In our region of the country, we have a lot of strokes.
Yes.
Related to what you just said. So a real severe stroke can kill you, right? You
Absolutely.
can die from it.
Absolutely can.
Others can just make you so disabled you can hardly function. Mm-hmm. And then there's ones that aren't that bad, but they're not good either.
No, of course.
You want to just talk about that spectrum a little
Sure.
bit of?
Yeah. So stroke symptoms do exist on a spectrum, which is mainly governed by where the stroke happens. So the brain has a geography to it. Different parts of the brain have different functions. And the place at which a stroke happens and the volume of tissue affected is what directly correlates with how severe your symptoms will be. So you can have, a relatively small stroke, when you take the brain pictures in MRI, that can be, like you mentioned, incredibly disabling. They can, make you paralyzed, make you difficult to talk, difficult to walk. But you can also, if a stroke happens in another place in the brain, have something that's much larger and overall do pretty well.
Jumping a little bit here, what should a person do if they think they've had a stroke or they're having strokes?
Yeah. So if anyone develops stroke-like symptoms, so if you develop sudden onset of weakness on one side, numbness on one side of your body, difficulty understanding language or making language, difficulty with double vision or vision loss, vertigo or like a dizzy feeling, you should come to the emergency room immediately. Stroke treatment is predicated on time. The phrase we use is time is brain. And the faster you can get to the emergency room, there's a chance that we could give you a medicine called TNK or tenecteplase. That's a very strong blood thinner. It's called, colloquially the clot-busting drug, where you can actually break up a blood clot, blocking flow to the brain and reverse the symptoms of a stroke. And that time window is very, very tight. We're restricted to giving it to folks within 4.5 hours of symptoms starting. That doesn't mean wait 3 hours to come to the emergency room. The sooner you get here, the sooner and better that medication works.
And that determines the outcome a lot of times.
Absolutely. Like I mentioned before, the volume of brain affected and the location affected directly determines your rehab potential. And getting to the hospital sooner will almost certainly give you a better chance of having a positive outcome as if you waited a few days or even a few hours.
Great information. Thibodaux Regional has now become the primary stroke center for a 7-parish area, and you and your compadres, meaning the other guys that work with you, all young, well-trained doctors, are the guys, the physician piece of that, which is an incredibly important piece. The rest of it is the treatment protocols and so forth that are established mostly in our emergency department, but also our critical care unit and so on. So thank you again, Dr. Bryce Casteigne. I can never say his last name right. And for coming here today, and we want to have you back in the future.
Yeah,
Thank you.
Thank you.